I'm really excited to host our webinar today on how to make virtual physical therapy an effective part of your employee benefits package. We can flip to the next screen and do some intros. Up one, there we go. My name is Dan Lord. I'm the program director here at Crossover Health. I oversee the integrated service lines and who we hire, our standard of care, and how we really deliver on our outcomes. And I'm going to pass it off to Nicole.
Hi, everyone. I am Nicole Liu. I have worked in the corporate healthcare and wellness industry for the past 6 years. I am now the virtual physical therapy lead here at Crossover, so I manage our team of 8 physical therapists across the country. I've been seeing patients virtually for about 2+ years, and I'm super excited to be here to talk to you all about virtual physical therapy. I will go ahead and pass it off to Matt.
Hey everyone, I'm Matt DeBull. I'm a physical therapist and board certified orthopedic clinical specialist. I've been at Crossover for a little over 4 years now and have got to see an integrated approach from a bunch of different perspectives, working at an on-site, near-site, and now as part of a virtual care team. And I also serve as the program manager for our Physical Medicine Guild.
Thanks so much, Matt and Nicole. So nice to have experts here to talk about this important subject. And if we could go back one to our agenda slide. Today, what we want to go over is really what is virtual physical therapy. And this is really important because the landscape is changing. We've all been dealing with a pandemic over the last year plus, and that really changed how healthcare was delivered. And we saw a lot more virtual care delivered in all of the different spaces, but especially in physical therapy. And because of this, there's been a ton of different entries, different digital point solutions that have entered the game. Remember, this is a $200 billion problem, and employers are really trying to figure out how to manage their MSK spend. So we thought it would be really important to really, tell you guys how to ensure your virtual PT solution is beneficial and go over the 5 key ways. And then at the end, we're going to have time for Q&A. So please use your chat function to submit questions throughout this talk. Don't worry about taking any notes. We'll send you the recording as well as a reference document at the end of this webinar. So thanks again for joining us, and let's jump right in. So what is virtual physical therapy? I think it's important to define it. And I have our expert, Nicole, here to talk about what it's like to have an expert in your pocket.
Thanks, Dan. Yeah, so virtual physical therapy, as Dan said, is essentially having an expert physical therapist in your pocket. So this expert just happens to look like our very own Matt DeBull, which who wouldn't want this physical therapist in your pocket, right? I often joke with my husband that I am our friends' most useful friend because I get so many texts and FaceTime calls and voice messages from our friends who are asking questions about their bodies and injuries and posture and workstation setup and everything under the sun. I think if you know any physical therapists, they could probably attest to the fact that they get the same, that they are probably their friend's most useful friend also. So these friend consults are not that different from what we do as a virtual physical therapist. Patients engage with us online to start. We maybe exchange, a few messages back and forth to figure out what's going on with the patient. We'll do an initial assessment, typically via a video visit. We listen to their histories, complaints. We watch them move if need be. We will come up with a hypothesis or a PT diagnosis, and then we form a plan, and we do a lot of education and give exercises. The beauty to me of the virtual space is that after that initial assessment, we have frequent check-ins with the patient between virtual visits and even after they're done doing video visits. We do these mainly via messaging, and so we can change and update their programs way more frequently than we would do if we were in the clinic seeing them once a week or even biweekly. So these patients have access to us all the time. We really are like an expert in their pocket. So, when they're at home and they're wondering, should I go for that run? My knee's been hurting. Like, is that going to overdo it? Or why all of a sudden, like, is my shoulder making this weird noise? Which are totally questions that we get. Instead of going online and Googling it, which is often what people tend to do, they can just pull out their phone or open up their laptop and they can message us and ask. So even though we aren't per se putting our hands on them like we would be doing in clinic, I think that the care is still very much hands-on. Go ahead and go to the next slide. Thank you. So let's be clear about what we mean by virtual physical therapy. So virtual physical therapy is expert musculoskeletal care by licensed physical therapists. This is important because I've seen a lot of different products and services stating that they're doing virtual physical therapy, but they don't have licensed physical therapists on their teams. The APTA, which is the American Physical Therapy Association, they actually just released in the last couple of weeks a statement on this, stating that in order to be doing virtual physical therapy, you have to have licensed PTs on your team. Virtual PTs must abide by the state-specific laws and regulations, and I won't sugarcoat it. There are a lot of state-specific laws and regulations, and the laws and regulations, they're different for each state. So on our team, we carry 50 state licenses across our team, and we have to be sure that we're keeping on top of like license renewals and Con Ed requirements and making sure that we can legally practice in those states. Virtual physical therapy can be accessed anytime and from anywhere. We are truly a PT that you're just carrying around in your pocket. It's very personalized, and I think it has to be. We're going to talk a little bit more about this and why it has to be personalized, but musculoskeletal issues are very multifaceted, so we must have care that is personalized for each patient. Our ultimate goal is to get them better as fast as possible. Virtual physical therapy is really not that different than in-person physical therapy when it's done right. So during an in-person visit, only a small amount of our time should really be spent to hands-on evaluation and treatment. The majority of our time should be spent listening to the patient, developing a hypothesis, creating a program, prescribing exercise, education, those kinds of things. And in the virtual setting, we're still able to do this. And we have the added bonus of being able to check in with our patients and answer questions whenever they have questions, which is, I think, one of the most exciting parts about doing physical therapy in the virtual setting. I'm going to hand it off to Matt to talk a little bit about the landscape of virtual PT.
All right, thanks. And so, while we have this service line defined, virtual physical therapy still comes in a lot of shapes and sizes. And I know that it can be confusing to try to decipher what do I need, or what does that service offer in a specific situation. And so I think the best way to simplify this is to try to categorize along the level of expertise that's coming from that service, and then the scope that they can manage through the condition. And like all industries, there are a bunch of options for a whole host of things. And I'm going to just try to outline this from a food shopping analogy. Like in food shopping, you have a lot of different choices. You might go to your corner store or convenience store, but you know that you're going to get just like this limited scope of options, limited quality. It's good for simple, quick fixes, when you're in a pinch. But it's not going to be a really good strategy in the long term if you're shopping there for all of your food needs. And so, yes, it's convenient and it's short. It's a short-term strategy, but it's not a really good long-term strategy. And that's kind of what we see clustered down there at the bottom and lower part of the graph, where we're seeing a lot of bot-based interventions, unlicensed interventions. They can do a limited scope. That's like the convenience store option. And you have a smattering of other options. Maybe you are actually getting licensed providers, but they could also be in sort of a limited scope for specific joints, selecting hip, knee, shoulder, but nothing else. And then at the top of the graph, we can kind of equate these offerings to something more like your high-end specialty store, which has a bunch of options, not only just for food, but they have fresh produce. They have a section for household supplies, cleaning supplies. They also have a pharmacy attached to that to that store. And so now you're getting a whole integrated approach for what you need in the grocery store, or maybe even more. And that's similar to how we see this level of expertise being deployed through some of these other options. So you have a virtual PT who's integrated with a whole host of other service lines. And because of that, they can see full scope musculoskeletal in times when maybe it is still musculoskeletal, or they're even positioned to handle things that might be a little more sinister or masking and presenting like a musculoskeletal complaint. So from our perspective, of course, there's a lot of different options out there. And I think when we talk about it, we identify ourselves as being that orange dot up in the top, able to do all with an integrated team and licensed experts. And I'll pass it back on over to you, Dan.
Thanks, Matt. It's really important to understand the landscape and understanding really the scope of what you're purchasing for an MSK solution. And, to your point, Matt, you need a full scope in order to actually make an impact and have outcomes that bend the cost curve. So, Matt, with so many options in the marketplace, what's your advice on how employers can really make an educated choice and make sure their solution is beneficial?
Yeah, so let's get into like kind of our 5 main things to look for, and when we talk about things to consider. So we'll start with the first, which is a relationship-based approach here. And I know that a lot of times what we hear from our members and patients is that they have pain, and they can say it's in their knee or in their shoulder, that's limiting them from doing something specific, like reaching overhead or carrying something or working at a computer. And for us, that's a very surface level or superficial part of the conversation that, yes, like it's easy to identify, it's easy to communicate, we can ask questions around this, but we also know that we're treating a whole person here. And that's where taking a relationship-based approach really matters. We don't want to feel like we're strangers. We want to feel like we're familiar, and they are absolutely part of a dedicated population, and they're accessing a dedicated team of healthcare professionals who are invested in their health. We're not here for that single serving, episodic care. We are invested in the long term. So let's get to understand, how does that pain and functional loss impact things like your attitudes and beliefs about your health? Do you feel old, or do you feel like you can't do this or can't participate any longer? Do you feel threatened by your ability to perform your job duties and be there for your family, or maybe serve your role as a caregiver or primary breadwinner for the family? Like, does this impact that to that degree? And so we talk about the things that are under the surface. Like the iceberg is easy to be seen, but there's a whole host of things underneath it that can also impact how you're feeling and the prognosis and our treatment approach. So we want to build confidence, we want to build trust. And when those things do come to the surface through our conversations, we want to also have a really great integrated care team that we can trust in our referral network. And that's why we love having this integrated team of providers alongside of us. It is more than just an episode of elbow pain. It impacts them as a person and in the context of their lives. We want to be able to unpack that with confidence and know what the next step ought to be if those things need to be addressed more formally. And Nicole, maybe you can talk a little bit more about the provider integration and how that works with our virtual PTs.
Yeah, sure. Thanks, Matt. Yeah, to echo what Matt said, I think that provider integration is really key to fully reap the benefits of virtual physical therapy. And I should say that this isn't specific to virtual physical therapy, because I actually think that provider integration should be the same, whether we're talking about, in person on the ground physical therapy or physical therapy in the virtual setting, or a hybrid of both. There's a few reasons why this provider integration is so important. The first is efficiency. Typically, patients will go to their primary care doctor for musculoskeletal issues, only to be then sent to a physical therapist. Also, physical therapists are often limited in states by visits or months, how long they can see the patients before the members or the patients need a physician referral or physician diagnoses. And so we're able to cut out a lot of this back and forth, because If the patient starts in physical therapy and they do need to see a physician, we have physicians on our team. And so the experience is just very seamless. The efficiency aspect also saves a lot of cost. So MSK spend mainly comes from, we know, surgery, imaging, ER visits, urgent care visits. And by going straight to physical therapy, and even better physical therapy that you can access very quickly, like in the virtual setting, you can avoid a lot of these things. I remember last year, I actually had a patient who had woken up with really, really excruciating back pain to the point where he couldn't get out of bed, and he didn't have a history of back pain. And he was trying to actually go to the ER urgent care because it was so bad, but he couldn't even get out of bed and get in his car. And so he signed on and started a conversation, and I was able to meet with him via video visit within a couple of hours and give him a lot of education and reassurance, like rule out red flags if he really did need to go to the physician, and then get him started on recovery. And I think that this kind of efficient care is just so key for musculoskeletal issues. The second thing is the patient experience. So we really want to be able to take care of patients who've been passed around the medical system, right? Like we want to be able to take care of these patients with really complex musculoskeletal concerns where they've been to multiple doctors and a few surgeons and multiple physical therapists, and no one really wants to own their care. And I think that having provider integration is really key for that, because we are able to address all aspects of their care, like Matt was talking about. And we're able to, in the virtual setting, invite the physician or invite the psychologist into our virtual room and do a co-treat with them, right? And have all the providers on the same page. It's kind of like doing grand rounds in the hospital, but we're able to do it with the patient involved, which I think is really special. And the last is complex issue management. I think that physicians just need better tools than just imaging, injections, and opioids. And we know that referring musculoskeletal issues to physical therapists can save cost. As Matt mentioned, physical therapists should be practicing within the biopsychosocial model, meaning addressing all aspects of patients' care, not just like the mechanical cause of back or neck pain. And I think that in order to address all aspects of patient care, physical therapists can very much quarterback patients' care, but they need an entire team behind them to support the patient, because there are healthcare providers that are more knowledgeable about other things than we are. And I think that that helps us get patients better faster. I think that our biggest successes with patients often result when we do work together as an entire primary health team. And if you go ahead and go to the next slide. One back, yeah. This is just one member testimonial that we received very recently, actually, for a physical therapist who's on my team. And this patient wrote in that they had started physical therapy for her low back pain, and she was given exercises and it was going okay. And then she eventually hit a plateau, which is pretty common in rehab. In this case, the physical therapist was able to discern that she had perhaps plateaued because there were some other life events that were also getting in the way, and recommended that, maybe she talked to someone on our mental health team, which she did. And she ended up having a physical therapist, a doctor, and a psychologist all working together on helping to improve her back pain, which I think is a great example of our provider integration. I'll go ahead and hand it back to Matt.
Yeah, so if you go to the next slide, the third point that we want to bring up, and I think, Nicole, you hit on this quite a bit, but when you do have this relationship-based approach inside of a integrated care team, you really do start to be able to bend the cost curve from a number of different ways. And so just to contrast that with what is kind of the siloed care model, we have some donuts here on this slide deck. And the large, the grayscale donut there represents when you have a siloed bolt-on solution that's maybe serving more as like a point solution inside of a larger ecosystem of healthcare benefits. You have, yes, access to a virtual PT, but only, and it's limited. And it doesn't necessarily serve the purpose of preventing somebody who's really worried about a condition from going and seeking prescription medications or getting advanced imaging or pursuing surgery. reaching out to their ortho specialist or even going to the emergency department. And as Nicole said, there are those complex issues that drive up healthcare spend. And it's actually the smaller component of people who are going out and spending the larger component of healthcare spend that we really see impact on the cost curve. And so your total healthcare spend can be mitigated by, and I love how you said this, Nicole, like having the right provider at the right time and delivering the right care. So when somebody needs your advice and needs reassurance, they can connect with you immediately. And then as part of a virtual physical therapist, as part of an integrated care team, you can pull in the physician and actually do a joint consult in the moment. You have a whole lot more access to your primary care team in this scenario. And that's where we see that donut on the right, the colorful one. You're driving down overall healthcare spend because you don't rely on that secondary care network for medications, images, surgeries. You're not over treating in those instances. Of course, they're there when it's needed, but you have that like long-term cost savings that comes with preventing downstream cost. And I think maybe the last little part to talk about in terms of bending the cost curve. So it's not just the immediate savings by having this integrated team with an efficient system. It's not about also mitigating the downstream costs. It's also about actually saving costs and time and energy in the actual episode of care. So when we're treating somebody who needs our help, our track record really shows that they need less interaction with us in terms of visits. On average, we see our patients for around 4 visits because we're also utilizing a whole host of other tools in the virtual space, like messaging, like our exercise programs, ongoing communication and care conversations are occurring outside of the visit windows. So we can actually help somebody reach their goals in a more efficient way, needing less visits over time, less billable units, if you want to call it that. So there's cost savings just even inside of an episode as well. And hopefully we impact it in a way that they're going to come back to us first. They're going to stop seeking out those other avenues to try to get their questions answered. And yeah, rather than going to the emergency department or Googling, they're reaching out to us, which is a huge benefit, huge cost savings in the long run. And that's really how we impact cost in our model. So maybe I want to bring it to the 4th point here, which is, how do we show that we're being effective? And what I love is that any solution that you're looking for ought to be able to prove outcomes. So yes, we could talk about patient satisfaction, but we take it a step further. Now, we love our patient satisfaction numbers with our NPS scores, but we also look for us to have strong therapeutic alliance. And so we use a tool to help measure that. So therapeutic alliance between a patient and a provider is incredibly important, and it's a predictor of health outcomes. And we want to measure that and make sure that we're optimizing for it. And then we're also looking at, of course, cost, like we talked about, but functional improvement or the ability to help somebody reach their goals. And we're really proud to say that over 70% of the people who engage with us are seeing a significant functional improvement within 6 weeks of time. And so we have these performance metrics that we are interested in, and we are confident in them such that we want to put performance guarantees around those and really show that we have some skin in the game to be a partner in your healthcare journey. It's not just about putting up some flashy numbers. Like, there's a lot of substance behind our claims, and we want to make sure that we're achieving the desired outcomes for all parties involved. It's really important, and it should be an important factor in deciding whether or not a solution is going to be helpful or effective for your own employee population. And then Nicole, you can talk about this last one here, the 5th one.
Great, thanks, Matt. So the fifth and final, and I think probably the most important way that that a virtual physical therapy program is going to be beneficial is that it doesn't have a one-size-fits-all approach. We know through a lot of research that musculoskeletal pain is complex, can be complex. We know the human body is very complicated. We know now that it's not as simple as giving the same set of exercises for all of back pain or prescribing exercise based on an algorithm. Our profession has really evolved from the days when we would see a patient with back pain and we would go to our manila envelopes that had a label that said back pain, and we would pull out a sheet of exercise and we would hand it to the patient, and the exercises would have maybe a dozen or half a dozen exercises, and they would be every other day, 3 sets of 10. Like, we've come a long ways from that. We know that care should be personalized, and when it is personalized, that it's a lot more effective and efficient. Because musculoskeletal pain can be complex, we need an approach to musculoskeletal care that is very dynamic. It has to be flexible. Like I said, it should be patient specific, and it has to be multidisciplinary. We want care that is quarterbacked by physical therapists because they're the experts in the field, but that there's an entire team supporting them. And we really need care that works. Matt, do you have anything to add?
I love that we have a dynamic, system that doesn't have just one size fits all approach, because everybody is an individual and has a unique problem and unique context to their problem. So we have to be able to accommodate. And I really feel like inside this one size fits all approach can't work is we lose the humanness of that interaction when we try to just template everything or have it be protocol based. And I don't find that to be satisfying as a provider, and I don't find that to be satisfying as a patient either when receiving care. I want to be heard and listened to, and I want to make sure that my provider knows my unique circumstance before I'm even going to, contemplate taking their advice. So I love that we do that in our model. And I think it's really important as a point to bring up when evaluating other options.
Thanks so much, Matt and Nicole. That was just an awesome overview of how virtual physical therapy is and should be an effective part of an employer's strategy. Let's jump into some Q&A now. I saw a couple of questions come through, and please, add any more questions as we answer these first couple. So question 1 to you guys is, how do I know if a virtual physical therapy offering will give my employees ongoing access to a licensed PT? Maybe I'll direct that to Nicole first.
Yeah, so first and foremost, right, the virtual physical therapy has to be run by physical therapists, right? I think that's the most important thing, right? They need to have licenses in every state where they're practicing. That's super important. Virtual physical therapy is a pretty new field, and there hasn't been that much regulation on it yet, but it's definitely coming. I think that the pandemic has highlighted the need for physical therapy to move virtually. And oftentimes what happens is the regulations and laws and stuff kind of catch up. And the physical therapist who is doing virtual physical therapy has to be, one, it should be a real person, and that real person should be able to follow through a patient's entire program from start to finish, right? So whoever is the first interaction, they should be able to form a relationship with them and then follow their program through discharge. And even after that, then when the patient has something else come up or has a new question or a new concern, they should be able to access that same physical therapist. Matt, do you have anything to add on that?
I think you said it well. You could certainly check credentials. I think that should always be available, to understand who am I actually getting care from. They need to be licensed in the state of practice that the patient's located in. And I think that's not always well known. So that includes when somebody might be traveling across state lines, that impacts access to a licensed physical therapist who is licensed in that state. So that needs to be managed, and that's part of this conversation. But then I think also, when you're looking at, how to then integrate some of that care team, just understand that there are some very restrictive states which might only allow for a relationship between a physical therapist and a provider to exist for under 5-10 days before requiring a physician's referral. So just double checking that even the licensed physical therapist is able to practice physical therapy within the state regulations. That's an important part. It's a little nuanced, but it's absolutely key to follow the law and licensure requirements.
Yeah, I mean, it makes sense if you want to really bend the cost curve and change how much money you're spending on MSK. You need to be able to have the right scope, and the right scope means the right license to actually work on real MSK diagnoses, right? If it's just a health coach or a bot, legally they can't work on hard problems because those have diagnoses behind them. Okay, so next question. Similarly, what are your thoughts on health coaches leading these virtual programs and having them escalate to a physical therapist? Does that help with the biopsychosocial model? And maybe Matt, I'll start with you this time.
Ooh, oh man. Honestly, something that keeps me up at night is I don't know, a service line posing as a solution, but it's really unable to deliver on what it promises. And I think this is a situation where whether it's a health coach, no knock to health coaches, but a health coach or a personal trainer or a life coach or whoever we're talking about that kind of does not follow state board licensure requirements or regulations, they really shouldn't be involved when there is a MSK diagnosis to be made and to treat, especially not in the front end of that experience. I understand that maybe a service line can be set up that way, in an intake type of way, and they'll manage the things that don't need much care. But I think that's a really poor way to set up a solution. Is to give them something else other than what they're expecting, at the front of the door, and then ushering them to a place like a physical therapist where they can get help. I don't think it's following a strong biopsychosocial model necessarily. I think that health coaches have a place, obviously, in part of the care team, but probably not at the front of the door for MSK disorders. Nicole, you have anything to add?
Yeah, that's exactly right. I want to just, also state that we have health coaches on our teams. We work very closely to them. They are very important members of our teams, but their training is really not in specifically musculoskeletal complaints, issues, pain. That's like really not what their training is. They have a much more broad training, and I've gotten to know a lot of our health coaches really well. And we've talked a little bit about that. Physical therapists, because of the introduction of direct access, like our profession was designed to move into owning the front door of musculoskeletal care, like Matt said, and that's very much in our training. So what that means is when people come to us without having seen a physician or something, it's our job to tell whether or not they need to go see a physician, like whether or not they don't belong in virtual physical therapy. And that's really important. To me, that's as important as us delivering good care. Because what I always tell our patients is if we are not the right fit, we will get you going wherever you need to go as fast as possible and as efficiently as possible. And virtual physical therapy is not for everything, right? I do think we can manage a lot of MSK issues. We cannot do everything. But I really trust our team of physical therapists to know what is and is not something that we should be managing. And I don't think that health coaches have the same training to be really sitting at the front door for musculoskeletal issues.
Thanks, guys. Next question is, should we consider solutions that use wearable sensors or computer vision? And I'm going to take the first stab and then pass it back to you guys. One thing to really understand is there is no widget or magic bullet that increases the effectiveness or efficiency of MSK care, period. Right? There's no wearable, there's no computer vision that changes the impact a PT can have on a patient. yes, these things are nice to have and they could impact stickiness or engagement. So I'm not saying that you throw them out, but what's really important is the relationship between the PT and the provider, not the tech behind it. The tech should enable it, sure. But I just want to point that out, that none of these things will change the quality of the PT delivered. Matt, Nicole, would you add anything to that?
Yeah, Dan, I agree with that. This is a hot question, right? I think that a lot of MSK solutions right now have these sensors or gadgets and things to oftentimes measure joint angles, or maybe like a squat or something like that, to give patients and providers feedback. What Dan said is right? Like, there is a chance that it increases the stickiness, right? That it increases the patient's buy-in. There's also the chance that it does the opposite, right? That it's one extra barrier for the patient. They have to go and they have to set up their markers so that their wearable is on just right, that kind of thing. But I think the bigger thing to think about is, what is the ultimate goal, right? And for us, for physical therapists, I think, who are doing it right, like, the goal should be to increase the patient's functionality, right? Maybe to decrease their pain, to make them live a better life. And so is, a knee flexion angle increasing 5 degrees, maybe, there's obviously some error. Like, is that really making that big of a difference? Or is it a big difference that they can now, squat down and like pick up their kid off the floor? And I think we need to draw the focus away from a little bit of like the measurement and put it more towards the functionality, because that really is ultimately what people care about. And after doing this for a lot of years, you could increase their range of motion a certain amount, but if they're not doing what they want, they really don't care that much. And I think that there are other ways that you can get what we call objective measures, such as what the wearables do, that don't involve using a wearable, right? So that the patient can test and retest if they're making progress. I think that's really important. But at the end of the day, for the patients, it tends to be about if they're able to get back to doing what they want. Matt, do you have anything else to add?
Yeah, I think they're fancy. They probably, the wearable sensors and computer vision probably exist because some sort of product team decided that this could be a way to sell more of our product, and said, hey, here's a fancy, flashy thing. And in some ways, it makes an offering a little more attractive if you are uninformed with what actually matters in delivering care. I don't think that it's the providers necessarily saying, I can't do my job without wearable sensors or computer vision. I don't think it's the patient saying, I don't think I can do my rehab without wearable sensors or computer vision. I think it's a lot of smart people coming up with some really cool tools, but when you add it to a service line, it becomes an expense for whoever's purchasing that, and probably not adding a whole lot of value in the long run.
Thanks. Very well said. I want to close with this last question here. Most PT vendors talk about the importance of relationships. We've heard this before. How do relationships with providers at Crossover Health differ from relationships with PTs at other virtual care vendors? And maybe Matt, I'll start with you on this one.
I actually like this question. And maybe part of my experience can help answer it. So, as a provider at Crossover, I started at an on-site clinic and a near-site clinic. And I think being part of those clinics, we were on campus for some of our employers, which meant that I saw these employees and the patients that I treated in the parking lot. When I came into work, I saw them in the cafeteria food lines. I'd pass them in the halls and say hello. And I think, when you can wave or nod or just kind of acknowledge somebody on campus, you feel like you're part of a community. I'm going to see their coworkers, probably. I'm going to see their spouses and dependents, probably. They're going to see my coworkers, like my physician that I work with, or mental health therapist that I work with. And so there's a reputation to uphold. I know I'm going to be seeing them again, and they're going to interact with me again. And I think that's part of the relationship building, is having that expectation that they can always reach back out to me, and I can always follow up with them. And the relationship that we have on the virtual care team is the exact same. It's the expectation that I'm going to see you again. I'm going to see your spouses, your friends, your coworkers. You're going to see my clinical team, and we have relationships with each other. It's not some unknown person who's just randomly assigned, who has no connection to my the physicians on my care team. I mean, we're part of the same network, and I love that about our model. I think we're probably a super unique offering when it comes to that relationship side of things. It's bigger than just the conversations we have in session. It permeates throughout how they utilize their healthcare.
Thanks, Matt. Anything else to add there, Nicole?
I'll just add that I think, what we talked about at the beginning about having a PT in your pocket, I think that very much is the ultimate goal. It's like how, if you have a friend that's a PT that you feel like you can just ask them any questions and they know your health history and they know what your goals are, right? You can pick up where you left off. I feel like that's the ultimate goal. I think that's where primary health in general really shines. It also saves you a lot of, like I said before, Googling things online. It saves you from asking other friends and just hearing anecdotally what to do. I think there's so much misinformation out there about musculoskeletal issues, pain, rehab, and how great is it to just be able to have a relationship with a PT and get the information from the expert just at your fingertips. So that's all I have to add. Thanks, Dan. Awesome.
Thanks. Well, let's end here and maybe go into our key takeaways. So thanks everyone so much for joining us today on our discussion about virtual physical therapy. I mean, we certainly have seen at Crossover the benefits of offering virtual PT as part of our integrative approach. We can really dive towards MSK outcomes if we add this service. And I think some of the key takeaways are: one, you need actual physical therapists, board certified in orthopedics, not unlicensed health coaches, to really achieve the goals that you have for your population. They're the ones that can really care for the whole person in a biopsychosocial model. The next, I think, takeaway is certainly you need to be tech enabled and digital first, but not tech only. Or not digital only, because the scope of practice that you have becomes smaller. And what are you solving for then? If your scope isn't big enough, you're not able to solve the hard problems and achieve success in some of those harder diagnoses, right? A full scope approach. And the last part is, if you do it the right way, you can bend the cost curve, and it can happen immediately. You can start preventing ER visits. You can reduce the amount of care needed within each episode and meet the person where they are, put some of those efficiencies against performance guarantees, and then also prevent some of the long-term chronicity that can happen when you start off in the wrong place. When you start off in the orthopedics office or with an unlicensed provider, you're on a train to more cost, more procedures. The story. So thanks so much for listening to us. We really, really appreciate it. If you have any follow-up, if you're interested in learning more about virtual PT and how we deliver it, for you and your employees, please reach out to either Courtney Baker or Dan Oftedal. We'd love to help you out and partner with you. So thank you very much.